Hi, I'm Lancelot Pinto. I'm a chest physician at the PD Hinduja Hospital and the Hinduja Healthcare Hospital at Bombay. I'm a respirologist by training and an epidemiologist as well, with a keen interest in tuberculosis. So how does one treat tuberculosis? I think understanding the treatment of tuberculosis becomes simpler once we understand the principles of treatment. There are three basic principles of treatment of tuberculosis. The first is the rapid reduction of bacillary load. And how does this help? The patient starts feeling better immediately, there is a clinical response, and equally important, the patient stops transmitting the disease to other individuals. This rapid reduction is achieved through the use of potent drugs such as rifampicin and isoniazid. The second principle is the prevention of emergence of drug-resistant mutants. And how does this work? The more the number of drugs, the lesser the probability of mutations, because TB germs undergo spontaneous mutations every few replications, and by using multiple antibiotics, we prevent the emergence of these drug-resistant strains. The third principle of TB treatment is the prevention of relapse. We do not want an individual to feel better and then relapse a few months down the road, and this is purely a function of the length of duration of treatment. So most studies have shown us that around 6 to 9 months of treatment seems adequate for most patients and reduces the rate of relapse significantly as opposed to shorter durations of treatments. So why do we use multiple drugs? So this all goes back to when streptomycin was used as a single drug. Individuals started feeling better immediately, but within a few months relapsed and worsened, and this was called the fall and rise phenomenon. This happens because TB germs undergo spontaneous mutations every time they replicate, and to prevent these mutations from becoming dominant strains, one uses different drugs to suppress all such mutations. What allows these mutants to be selected? Number one, if you use a suboptimal number of drugs, and again, if you use a single drug or two drugs for the treatment of tuberculosis, your probability of developing spontaneous mutations is very high. Number two, if you interrupt therapy, so an individual is responding, the number of mutants are very few, but you suddenly decide to stop treatment at 2 months. What ends up happening in such a circumstance is that the germs which multiply at this stage are very often the mutant germs and lead to drug resistance. The number third cause of this is low drug levels, and this is very often seen in individuals who have malabsorption states, individuals, for example, who are HIV infected and sometimes do not absorb the drugs adequately, resulting in subtherapeutic levels of drugs in their system, eventually leading to the development of mutant strains.